Okay, welcome everybody. This is Dr. Jody, and this is our very first T1D Crew Education Q&A Tuesday, and I will be doing these on Tuesdays. And the goal is that I do the training on a Monday, and then you bring your questions to Tuesday. But because yesterday's training was really about our education, our emotional health, and just really wanting to have all of you get the message that we really deserve to celebrate how hard we work, no matter what our numbers are doing, or no matter what the status of our days are right now. But this takes a lot of work, right? So Education Monday yesterday was really hopefully there to inspire you. So today is just going to be a free-for-all. Q&As obviously will build over time. More and more questions I'm sure you'll have, the more topics that I cover. And of course, future Q&As will probably be more directly connected to the topic that we did yesterday. But like I said, since yesterday wasn't a technical topic, you can bring any question you want to today. So we have 30 minutes in today's session. And like I said, my disclaimer is that I am not acting as a provider in these Q&As, nor in my Education Mondays. I am acting as a consultant. So that means I'm just telling you what I would do. I'm just telling you my opinion of what I would do, but I am not telling you what to do. I'm not your provider. So it's a very different relationship. Okay. So basically you guys are responsible for any decisions that you make based on what you hear in the T1D Crew education. And as you know, my goal is just to share what I know with as many people as possible. But clearly I'm not your provider. I don't know your dosing. I don't know your history. We don't have that level of relationship. So I just need to clarify that. And I will just open up. So there is a feature. If you guys look on your right side dashboard, you can type your question in there, or you can click on chat. There's a little chat bubble icon at the bottom, and you click on that, and then the chat window comes up. Or there's also a way you can raise your hand, and I think next to your name, if you put the cursor next to your name on the right and it says more, then you should be able to raise your hand. So, or you can just, because there's such a small group, because like I said, the really beautiful thing about all of you being one of the founding members is we're really having this very high level, high value, intimate Q&As, but my intention is that eventually there will be so many people that it won't be this intimate. So I just need to give you the heads up that you guys are getting special time and energy because you are the first ones on board. So, but I do have to set the expectation that it won't always be the same. But for now, and I'm not planning on really spreading the word a lot. I have enough of you guys in here already that I just kind of want to practice our membership program and get feedback from you before I keep spreading the word more and more. Like my goal is to, practice what we've got here for the next 6 months, tweak it, maybe change. Maybe I'm not going to be doing it every Monday. Maybe I'm not going to do a Q&A every Tuesday. I don't know. Maybe I'll change the time. Maybe I'll have speakers come in. So this first 3 to 6 months is really about trial and error to see what works best. And then probably not for 6 months. Well, I don't know. Who knows? I'm kind of building the plane as I fly it, if you know that phrase. So, okay. So feel free to write in the chat or raise your hand, but this is a free for all. Any questions you have?
Do we type our questions?
You can do one of 3 things. You can raise your hand. You can use the more option next to your name, which says raise hand, and then it just has a little hand that goes up next to your name. Or you can type it in the chat. Whichever is easiest for you is fine with me.
Okay.
But you can just raise your hand too. Like we don't, that is fine.
Oh, that would be a lot easier.
Yeah, I see all of you like Susan. Susan, go ahead. Just ask your question.
Should I, me?
Yeah.
Okay. You mentioned how protein, you can't just consider not counting protein. as well as fats. So I'd like to, this is kind of hard because I know what you just said, but can you give us more? I know maybe this is you're going to talk about this down the line, so I don't want to, but tell us a little bit more
Sure.
about covering the protein
do
and the fats.
Yeah, it's a great question. So as with everything with diabetes, everybody's going to be different. The more low carb you are, the more likely your body is getting used to turning protein into carb, because the body wants glucose. And if you're not going to eat carbs, it knows how to get glucose out of protein. So just a fun experiment I've been having people do lately is at noon or later, on an empty stomach, you haven't eaten for maybe 2 hours, you haven't done a bolus for maybe 2 or 3 hours, eat a whole bunch of protein. Eat a whole bunch of fish, eat a whole bunch of eggs, or, if you're vegan, eat a whole bunch of tofu, and don't dose for it. And watch over the next 4 hours what happens. It's just an experiment. So you can, I could tell you intellectually that protein might raise you, but it's a really powerful experiment for you guys to, have a good blood sugar number. And at like noon or something, if you haven't eaten or dosed since 8 or breakfast, just eat a whole ton of protein, eat like 6 ounces of protein or something, and just see what happens. So you can get your first experiment of like, wow, I had no idea, right? And protein takes a very long time to raise you. It might not start raising you for an hour or so. It might not peak until 3 or 4 hours, but it can digest for up to 5 hours. Obviously depending on how much you eat. So once you have that experiment, so because my philosophy is we're navigating diabetes, that's why this is called the crew. We're all on the ship together. We're the type 1 diabetes crew. We're navigating this together. And to be honest, I just put those two together yesterday, which I was really excited about, because I always use that we're navigating diabetes, and I love.
We thought you thought of that all along.
I know. I just figured that out yesterday, that I love, because I've been experimenting with like type 1 diabetes tribe and type 1 diabetes, this, and type 1 diabetes that. And I just was like, oh, I like crew. And I didn't even click until yesterday that I'm like, and a crew is who navigates a ship. And I always talk about navigating diabetes. You would think I would have already put the two together, but I was like last night so excited that I figured that out. So, because crew initially was like an acronym. I was going to have like a community of resilient and educated warriors. But I just thought I'm kind of over acronyms, and I was sick of that acronym. And I was like, I don't know if I want to be a warrior. That sounds like we're fighting a war. And I don't like to say that I'm fighting my diabetes. And I couldn't come up with another adjective that was a W. So I was like, screw the acronym. So I'll just delete the crew and just say it's a crew, or delete the dots. Anyways, tangent. What I do is, when I am eating protein, this is my own, if I'm just having a piece of chicken and a salad, I'll just say, well, I know I need at least 1 unit. Maybe I need 2, and I'll give myself 1 unit. And then maybe I'll give myself another unit an hour later. Because the other thing that you guys will learn from me is that I rarely think that 1 shot per meal is going to be accurate, right? Because 1 shot per meal works like this: peaks at about an hour, and then it's done, right? It's like starts working at 15 minutes, it peaks. Well, it can peak anywhere from 30 to 60, 90 minutes, but they just kind of average it and they say it peaks at 60. And then it tails off. Well, guess what? Protein doesn't digest that way, right? Protein doesn't digest like this. Protein kind of digests like this. It's like slowly turns into blood sugar over time, over like 4 or 5 hours. So basically, I guess at every meal. And my thought is generally, okay, I need either 2 units or 3 units here, or I need either 3 units or 4 units here. And so then my thought is, well, if this is a slow meal with a lot of protein and fat, I generally take my conservative thought. I think, you know what, I think I'll do 2 here. And then an hour later, I might go for a walk, or right after. I love using exercise right after, because if you go on a walk 60 minutes after your bolus is at its strongest peak. And if you add a walk, to that 1 hour peak period, you will bring a high down quite effectively, and more so depending on how big your bolus was. If your bolus was 1 unit, if your bolus was 5 units, a lot, right? So if you if you have that post-meal high coming, you might need more insulin, or you might just need to kick in the insulin that you already have, right? Do we need more insulin or do we need more patience? Well, I don't have a lot of patience, so I like to use a walk to speed it up, right? So I'm always navigating by like, I don't use carb counting much at all. I mean, I kind of have 1 unit to 15 grams in my head, but then I'm also eating so much avocado and chicken and nuts and olive oil and cheese that I'm always thinking, okay, I need at least another 1 or 2 units for all of that. And then in an hour, I might need another 1 unit. And that is how scientific I get. That's it. But the more fat and protein I eat, I will always add another unit or 2 to my meal because I have a big piece of chicken, or I have a whole bunch of, cream sauce, or I have a whole big avocado. I always think I need at least 1 or 2 units for that. And then an hour later, I will think I probably need another unit an hour later.
So
So
you don't split up that initial bolus. Like if you say, I need 2 units for that meal, you don't like split it up a little bit and say, well, I'll take some now and more later. You give the whole thing and then an additional?
Well, I do both. I do both. If I think,
Because you're fudging it all in your head, kind of. Yeah.
I always start with my conservative dose. I always start with the most conservative dose in my head, and then I see what happens over the next hour. But if I'm eating a bunch of protein and fat, I'm always expecting to give another something in an hour, always, because the digestion is going to take several hours. So, if I'm eating carbs and chicken, I always add like a unit for the chicken or something like that. I always just kind of, I mean, people have, maybe you're more of a numbers, like my accountants and my engineers, they hate that description. They just hate what I just said. They're like, are you kidding? And I'm like, no, I'm not kidding. I just guess. How can you guess what the wind's going to do when you're on a boat? You just kind of have to go with it. I mean, I have an email that this one guy is like, oh, I count up how many grams of protein there are. And I'm like, I've spent my whole life counting carb. I have no idea when I look at a piece of chicken, how many grams of protein's in it. But if you want to learn that new skill, this one guy particularly, it's a really funny video. I'll put it on the activity feed. And he times 0.6 per gram. So if he's eating 10 protein grams, he pretends he's eating 6 carbs. If he's eating 20 protein grams, he's pretending he's eating 12 carbs. And he times 0.6 of the protein and turns that into carbs, and he doses for that. But that still won't work if you give the insulin all up front, because it's not fast. You would have too much insulin up front. You would have the classic, you go low and after your meal, and then you go high 2 hours later, right? So when it's protein, just think I need to add a little bit more to this meal than just the carbs. And I expect to either walk or dose more in an hour. That's kind of how I do it. And how much you need to dose, you will have to figure that out. Do you need an extra 1 unit? I don't know how much protein you're eating. I don't know how much your body tends to turn protein into carb or not. I mean, I don't eat many carbs, so my body's very good at turning protein into glucose. And so I did this experiment myself. I ate like, I think a 4-ounce, 6-ounce piece of halibut, and I didn't dose for it at all. And I went up, I think about 80 to 90 points. But I've had people eat a piece of chicken, just a client last week. She ate a piece of chicken and she went up 20 points, Probably because she eats more carbs. So the body isn't as trained to be like, oh, here's protein, I'm gonna turn it into glucose. Does that help?
Oh, yeah. Yeah. Yeah.
So now I want to touch on the fat part.
I was just going to ask about that, because like different types of fats.
Yeah.
Cheese versus an avocado versus cooking your sunny side up eggs in butter or coconut oil.
Right. Well, it really has to do, so fat doesn't raise your blood sugar directly. Protein can actually turn into glucose and raise your blood sugar directly, although very slowly. Your fat isn't turning into glucose. What the fat is doing, and most people don't notice this unless you're eating over 10 or 20 grams of fat in one sitting. If you have a little butter on your broccoli, don't even worry about the butter. But if you're having a cream sauce and you're having an avocado and you're drinking some high fat milk, or you got cheese melted all over your fatty whatever else you're eating, if you have a ton of fat at your meal, it doesn't have to be unhealthy fat. It can be 2 avocados for a snack, right? It can be a whole bunch of nuts. What's happening is when the fat digests into fatty acids in your stomach and your intestines, like all the other food, it's to its micronutrients when it gets into your intestines, then all those micronutrients, i.e. these, in this case, fatty acids, get absorbed through the lining of your GI tract, and now everything is in your bloodstream. That's the process of digestion, right? Chew it here, the saliva breaks it down, the stomach makes it into liquid from all the acid in your stomach, then the enzymes in your GI tract break it down even more, and then the food gets into your bloodstream. Okay, so now that you have fatty acids, you have 20 grams of fatty acids now circulating in your bloodstream. Well, guess what else is in your bloodstream trying to do its job? Insulin, your bolus, your basal, right? Your insulin is in there. And now it's like there's a traffic jam in your bloodstream. There's a traffic jam because there's a bunch of fat in there. And guess what? That causes temporary insulin resistance. So you could eat a stick of butter on an empty stomach and you only have your basal rate or your long acting in you, and you will go high. Because suddenly your basal rate or long acting will not work as well because there's all that fat in the bloodstream suppressing the insulin's ability to do its job. Okay, so a high fat meal can keep you insulin resistant because all those fatty acids are in your bloodstream, and they're either going to become part of a new cell wall, they're going to become fuel, who knows what their job is, but they literally have a really long commute and they're circulating in your bloodstream. And the higher the fat, the more the fat, the longer the commute, the longer they're going to be in your bloodstream. So I've had people do temporary basal rate increases for 10 hours after a high fat meal. But I don't know, we have to be on our toes, right? We're sailing a ship. You can't just go to sleep when it's windy out. So is it 5 hours? Is it 10 hours? I would, the more unfamiliar you are with this, maybe just do a 10% increase the first time you have to have a high fat meal. And this is another test that you can do just for your own mental experimentation is at noon, empty stomach, no bolus on board, have an avocado or two. Don't do anything and see what happens. Eat a couple avocados at lunchtime with no insulin on board, no other food, and see what happens. Okay, how do you deal with food when you're backpacking and on a pump? Is it better to give a dual wave or second bolus later? Lorna, I don't care if you dual wave or second bolus or temporary basal increase. It's all a matter of giving yourself more insulin. Some people are more confident with one approach or the other. But if you're eating a high fat meal or if you're eating a lot of protein, you generally need a little bit of higher amount of insulin over time. And this one shot all at once effect will not match the blood sugar effect of this. If you have a meal that digests like this, a bolus like this doesn't work, right? And this is one of my, I have several topics that I'm very passionate about teaching, but this concept of microdosing is one of my favorites. Microdosing. You don't just need one shot per meal. Maybe, sometimes, maybe, I don't know. But I like doing conservative little corrections. People are like, oh, I thought you couldn't give another dose for 2 or 4 hours or something. And I'm like, if I'm 300 and I dosed an hour ago and I dosed 1 unit an hour ago, I'm not going to wait for 3 hours. Like, we got to use critical thinking. They like to give us all these hard and fast rules, like never take a second dose at least for 2 to 4 hours. And I'm like, that doesn't really work in my case or our cases ever, because you use critical thinking. I mean, if you gave yourself 6 units an hour ago and now you're high, oh, wait, like, don't be so quick. Just go on a walk. If you gave yourself 1 unit an hour ago and now you're super high, well, geez, so we got to use our critical thinking. Do you, are you high on an empty stomach? Are you, because you just woke up? Are you high because you just ate a big dinner and now you're going up even more? right? Like there's hard and fast rules don't work. We always have to be navigating the ship and considering the variables. Okay, Lorna, how do you deal with food when you're backpacking and don't have control over what you're given to eat? Lorna, I have never, in the bazillions of countries I've been to and however many different countries I've lived in now, go anywhere without bringing a whole ton of my own food.
Okay.
I will never go anywhere where all I get is spaghetti for dinner and bagels for breakfast and French fries for lunch. There's no way. I will bring bars. I will bring apples and peanut butter. I will bring powdered peanut butter. I'll bring protein powder. I'll bring nuts. I'll bring cheese. I will never go anywhere where I don't have any control of my food. That's my answer.
What about when you're asked the question, like, do you have any special dietary requirements? Is there a way of answering that, or?
Yes, I always say low carb is essential for me. Yeah, because if their breakfast is pastries and oatmeal, I'm like, granola. They're like, oh, it's really healthy. I'm like, sure, I know. It's going to be lots of fruit and granola and vanilla flavored yogurt. I'm like, no. No. So one of my favorite things to travel with is a bag of chia seeds, my bottle of powdered stevia, a glass jar, and a bag of raw cacao powder. So in my glass jar, I put 1/4 of a cup of chia seeds, I put a little bit of stevia, and a big spoonful of raw cacao powder. So now I basically just have sweetener and chocolate and chia seeds. And the only thing I need to make this delicious is hot water. And then I do that on planes, I do that on car rides. And sometimes if that's all I can eat all day, I will eat it. You know, you put the hot water in the chia, and after about 5 minutes, it thickens up, and you can make it rock hard, or you can make it more like, you know, tapioca pudding, like, just depends on how much water you put in. The classic way to make chia pudding, of course, is like put almond milk in at night and let it sit overnight, so the chia seeds have time to expand and not be crunchy. But the hot water makes that happen a lot faster. So if you use hot water, you can make it. So that is my top. I mean, I haven't traveled for over a year now, so I guess I forgot that, but that is my go-to, because as long as you can get hot water, I mean, you can get hot water on an airplane, you can get hot water in a gas station, you know, I mean, the only place you can't get hot water is if you know, don't bring a stove and a filter if you're in the wilderness. But that is because it, you know, nothing refrigerated, or it's tasty, and it's, you know, if people are eating cookies and I'm eating chocolate chia pudding, I don't feel so deprived. Who has not tried chia pudding of any sort? You guys, ladies, try chia pudding. I'll put that on my, I'll put that on the activity feed. I've got a whole bunch of different ways.
I'll do chia seeds or, you know, flax meal or something with breakfast in a bunch of like, you know, thawed frozen berries.
Yeah. Yeah.
Either one, but the pudding, no, I haven't.
Oh, well, Steve, you got to try it too, for sure. Kate, chia seeds are amazing. They barely raise my blood sugar. That is very true. Have you got, who's tried the flax muffin? Anybody? Susan, Sandy.
I tried it this morning. Delicious.
Oh, good.
And my son loved it.
Oh, good. You can make peanut butter banana. You can make chocolate. You can make blueberry. You can make peanut butter chocolate. You can make banana blueberry. Like, I love the flax muffin. Okay, Paula, what midday snacks do you have? I'm not a big snacker. But like, I was gonna go work somewhere else today. And so this is, you know, this is just rice, crackers, and cheese, because I don't mind having a dose for the crackers. I'm not zero carb by any means. But, you know, an apple and peanut butter, celery and peanut butter, cheese and crackers, cucumbers and hummus, carrots and peanut butter. I know that first sounded gross to me, but I actually kind of like it now. But nut butters and nuts, you know, they travel well. They're easy to bring. Or sometimes I just, you know, like I just make a salad, and that's my snack too. Okay. Chia seeds are amazing. Backpack, midday snacks. Okay, Susan, did you raise your hand?
Oh, I was gonna just say two things. You have to be careful on the flaxseed muffins to not overcook them, because the last time I made them, I'm just letting you know, they dried out, and I still, well, I actually couldn't eat it at one meal because it was just, it was not too good. But the first time I made them, totally wonderful. But you do have to be careful. You have to know what your microwave is.
I completely agree. It can be delicious, but not if it's too dry. Then it's disgusting.
The other thing I wanted to ask you is, because I have a glass of wine here and
Yes.
I was planning to sip it, and I thought, oh gosh, should I? I'm curious, what do you count anything for dry wine?
You know, I can't ever answer that question. And once again, you'll hear me say this ad nauseum. You'll have to experiment. I mean,
Okay.
there's so many different wines out there. I mean, I have no idea. And of course, there's no carb label on them, which is so annoying. So you know, drink it on an empty stomach, and hopefully that doesn't get you too tipsy, and see if you go up, you know, see how much you go up. If you have one that you love and you really want to dial in the dose on that one, you know, have it with no insulin on board and no other food digesting, have one glass and wait an hour and see if you know, you look confused.
Oh, well, normally, you know, if it's dry, now I'm not talking about anything sweet at all, but normally you either hear, sometimes you even hear that it makes your blood sugar go down.
Yep. Yeah.
And so I just wondered if that, you could say one or the other. I mean, that you got to watch it, because I mean, there's a lot of variables, because it depends on if you're eating food, if it's on an empty stomach.
Exactly.
But I just was curious about you personally with, well, I don't even know if you drink wine.
I don't like wine.
Okay. Well, that solved that problem.
I mean, I'll drink red sometime, but I don't, yeah. But my favorite answer for you guys for everything, and I like to empower every client I work with. Sandy knows this. I'll be like, I don't know. Why don't you try? I don't know. Why don't you try? I don't know. Why don't you try? You know, if you want to know for sure, if you have this one dry wine that I've heard that too, that dry wines maybe don't raise you at all. Tequila doesn't, vodka doesn't, you know, liquors, in like, not those. I like tequila and lime juice, and that only lowers me, because when you are drinking alcohol, your liver has to get involved with detoxing the poison that we are drinking, right? It has to detox the alcohol. And the liver's job 24 hours a day is to make a little bit of glucose all the time. But if it's going to prioritize detoxing the alcohol, and it's going to stop making glucose. Now, I mean, speaking in extremes, I don't know if it's truly stops 100%, but what I have learned is that some people notice a drop in their insulin needs for 2 hours for every drink. So the liver might be hampered for 2 hours per drink. But again, like you said, if you're having a big meal in the middle of your wine, you're not going to notice that.
Mm-hmm.
If you have a bender and have 3 drinks one night and go to bed, you could have a low, because it's going to be decreasing its sugar output for 6 hours.
Mm-hmm.
Yeah.
Yeah.
Okay, you guys. Well, I'm excited. We have completed our first Q&A, and I really want to honor all of you, like I said yesterday, that that you're investing in yourself, the time and the money to be here to improve your diabetes. So my goal is that over these next, you know, at least 6 months, that you truly are going to receive all my best training and tools. And my goal is that you have an A1C that makes you really proud. So what I'm going to do, thanks to Lorna's suggestion, actually, I can open up an activity feed of conversation just in the paid group. And there's just about 20 of you in the paid group now, 15 or 20 of you in the paid group. And so I I remembered I closed that because I didn't want two different discussions happening. I didn't want paid people to be chit-chatting and then the free people to be chit-chatting, because I wanted at this early stage everybody to have the same discussion thread. But I can open up just a chat in the paid group, and then that would be a perfect place to put questions there and just say for the next Q&A, you know, and that's also a great place because if you, I mean, obviously you're not going to be able to make it every Tuesday at this time, right? And I'm going to start probably doing different times as well. I'll probably do like, you know, an early time and a late time so I can get all the different time zones of people. So that is where you'll post your questions. Okay. All right. So Kate, I know you're there, but I know you didn't turn your video on. Thank you. Kate just said thank you. You're welcome. Okay, everybody. So have a great week. This week's assignment is to honor yourself. Honor yourself of what we went over yesterday, why you're a hero, right? You have resilience that's exceptional and you do it over and over. So I really inspire all of you to accept wherever you're at with your blood sugar, accept whatever's happening, and just be like, God, I worked so hard at this. I'm proud of myself. And I will see you next Monday.
Jody,
Yes.
I do, this is kind of curious. Last night, I realized this. You said you give multiple injections, but you always show your pump. So you're on a pump.
No.
Well,
I always show you my Dexcom. I don't use a pump. This is just my Dexcom receiver.
Oh.
There we go.
Oh,
Okay.
okay. I tried to think about that and I thought, that's crazy.
Nope, I'm not on a pump.
I
Okay.
think if I had to choose between a pump and a Dexcom, I would choose a Dexcom.
Oh, definitely.
That's my opinion.
The Dexcom, I won't work with a private patient unless they are on a Dex, because I'll be like, you won't gain everything you can from me if I can't see what your numbers are doing.
Yeah, but I'm on a Dexcom, but I'm also on a pump.
Yeah, that's fine.
Yeah.
Me too.
If you want a pump, that's great. Most people are on pumps, but I don't want one. But if you want one, that's great. Either way.
You never were on one.
Yeah, I actually worked for a pump company before I went to med school. Yeah. Okay, so I'm going to wrap up. All right. So you guys have a great week, and I will see you next week. Bye.
Okay.
Bye.
Thank
Y'all.
you. Bye-bye.
Bye.